There we go. Lots of folks jumping on. That's awesome. So I want to welcome everyone to our November 2023 Balance of State Continuum of Care meeting. I cannot tell if she is here. Diana, I am struggling to figure out how to share the slides in the proper form. So I don't know if you want to try, but I can't even find you on my screen to give you.
Sure. Hang on one second.
Yeah, let me give you co-host privileges here. So Diana and I are going to do a brief presentation about a Medicaid benefit. But before we jump into that, a lot of you have already started putting your names and agencies in the chat. So if you could continue to do that, that would be super helpful. We do take attendance for our annual competition purposes. So if you will be applying for Continuum of Care funds, please make sure your attendance is tracked. And then one final thing, before we dive into the business of the day, I just wanted to say thank you to all of you. I've seen a lot of you in person recently at different meetings, and you all seem tired, but still so committed to the work. And I just want to thank you for showing up every day. I know we feel it here sometimes, that the volume of work just doesn't seem to ever slow down, but you're all still here and you're smiling and you're so committed to the work. And I just want to make sure you know how much we appreciate all of you. So thank you. And I will now stop and let Diana share the screen. And one last thing, Diana and I did not prepare before this presentation, so we're going to wing it as far as who takes which pieces, which I think is fine. And we're going to do a very high level presentation. This isn't meant to make you an expert on this benefit. It's just more of a this is what's coming presentation. Is that fair, Diana? Okay. So, I think we've shared in the past that our Bureau, through New Hampshire's DHHS Medicaid, is it Division of Medicaid? I might get the names wrong. We applied for a state plan amendment back over 2 years ago now, or over a year ago anyway, for home and community-based services, specifically for a supportive housing benefit. It was approved as of July of last year, and we have been struggling to figure out the implementation. But Diana, who actually I'll have you introduce yourself in just a minute. Diana's been working with my team over the last several months, and we finally have a plan to move forward. So that's what we're here to share today. But Diana, if you could introduce yourself, that'd be awesome.
Great. Hi, folks. Thanks for having me this morning. I am a senior behavioral health policy analyst with the department in our division for behavioral health. And in this role, I am essentially like the Medicaid liaison for all of behavioral health. As most of you folks know, a lot of the individuals that you serve are either Medicaid beneficiaries or they have Medicare with Medicaid as a secondary, or they have spend downs, things like that. So I think you're pretty familiar. We try to weave as much of the behavioral health services that we provide through the Medicaid lens, so we have sustainable funding available for services, and we aren't as heavily reliant on general funds. So that's why this office, this policy unit office that I lead, is tied to those services so heavily. And for those of you there's many of you here, I may have met you over the years. I've been with the department for 30 years this time. And I've worked in every agency of this department with the exception of New Hampshire Hospital during that journey. So thank you all for the work that you do. It's incredible work, and New Hampshire would be nothing without people like you.
All right. I'm going to move on to the next slide.
Sure.
All right. So Diana, do you want me to lead this and you can step in where needed, or do you want to take this piece and I'll take the services piece?
Okay, I'll go with here and you can do the services piece, because so Melissa and her team were the leads on applying for this Medicaid state plan benefit. And then myself and my team have been sort of guiding how we can implement it now. So what we've looked at is taking what we put in the application that CMS approved and figuring out a way to crosswalk an implementation approach based on the population to be served under this benefit
Hey,
package.
Tammy, can you call Kristen on Teams and find out what she needs?
Sorry. Okay, so this benefit would serve individuals who potentially are already in the Choices for Independence program, or under the other waiver services under an acquired brain disorder or developmental disabilities. So those are 3 waiver benefit packages we already have for the state, and that this package also serves that population too. And then also individuals who have serious mental illness. So a lot of those individuals are engaged with our community mental health centers. Also we have individuals who will be eligible based on substance use disorder. So we really had to come up with a customized approach to ensure, one, that there's no duplication of services, because some of the services in this particular benefit package are available in those other packages, right? So we had to sort of figure out that custom approach. And then we also need to make sure there's some basic tenets that we follow of this benefit, which is, the consumers, the individual's freedom of choice of their providers, and not putting sort of artificial barriers in the way, like you must receive this service, you must receive that service. So we had to sort of think about those freedoms that people have. We will be using our.
Yeah, do you see where
go ahead.
Can everyone who's not presenting please mute so that we can hear the presentations? Thank you. Sorry, Diana.
That's okay. Thanks. So also we will be using the New Heights eligibility system to help support the application and the eligibility determination process. This is a software that I'm guessing many of you are already familiar with to some degree or another, and we'll be setting up what we're calling 4 eligibility tracks. So the customized approach will be married, if you will, connected, if you will, to an eligibility framework within New Heights, and there will be 4 specific ones. That will allow us to sort of right size the benefit package for the individual so that we don't have duplication of services happening if they're already getting the benefits of a waiver or services out of a CMHC. And then we will also be looking for the department's providers and the partners that assist Medicaid beneficiaries with applying for the benefit through the New Hampshire Easy portal. That's the sort of online face of New Heights. And then the eligibility determinations, all that application information will flow through New Heights, land in the Bureau of Homeless Services, and their staff will be doing the eligibility determination to make sure that if it's Diana that's applying and she's eligible, she's turned on for the benefit and the customized approach that's right for her. Melissa, do you want to take questions after, or do you just want to take questions after each slide?
We could pause for just a minute to see if there are any questions. We don't have too many slides total, so. And if you come up with questions, stick them in the chat and we can check in with them each slide. How's that?
Great.
I don't see any yet, so I think we can keep moving.
Okay. All right, so the approach that we're looking at is we used this colored grid, and is it big enough for most of you to see?
It looks good for me, Diana, and it's on my small screen, so.
Okay, all right.
So we can share the slides after so people can see them.
Right, so there's 4 services associated with this benefit package. There's targeted case management. There is a service assessment / development of a plan of care that has to happen annually. There's also a supportive housing service, which is a per diem service. And then there is a one-time service that's called community transition. It's essentially some setup costs associated. So there's only 4 services. It's a very small benefit package. Now, if you happen to have an individual that you're working with and they have CFI services, they are already getting, in all likelihood, depending on what their care plan is under CFI, they already have access to the first 3 services. That's why they're in green, because they're good to go. These individuals already have that. They're good to go for these services within those benefit packages. What they don't have access to is a community transition benefit under the CFI program. So that very first benefit eligibility group would be this type of person where they only need this benefit. We would open that up in the system for them to have access to that service. If the person has services under the developmental disability waiver or the acquired brain disorders waiver, they already get targeted case management as part of that waiver service. They don't get these other 3 services. So they would need to get a service assessment. So they'd need, under the supportive housing benefit, to get an assessment so you can determine what their needs are and for you to be able to develop a plan of care. And that would have to happen annually. They would need the supportive housing per diem benefit so that when there's a supportive housing worker that is trying to assist them on connections with some landlords or developing better relationships with their neighbors if they're already in housing, et cetera. That's what this role would do. And then also a one-time potential community transition service if they needed that. So for this group of people, the DD, the ABD waiver participants, these 3 blocks are what would be available to them under this benefit package. And someone is off mute again, just sharing that. Under the individuals who might have a serious mental illness or youth that might have a severe emotional disturbance, they often will get services through the Community Mental Health Center system of New Hampshire. Individuals who are able to access services under the community mental health benefit in New Hampshire have access to targeted case management already, and they already have an annual service assessment that gets done. For those individuals, if the community mental health center was going to be their supportive housing benefit provider, they would simply need to expand the annual plan of care to address the components that are required for supportive housing. So those 2 services are already available. So this individual going through this system, their supportive housing benefit would be opened up for the per diem service and for the one-time community transition service. And then the last major group are individuals who may have a substance use disorder with the history of duration, et cetera, that's addressed in the application in the approved plan, and they meet the supportive housing eligibility needs, the balance of those. Right now, we don't technically have targeted case management sort of turned on in our Medicaid system, but we are adding that for a variety of programs, not just for the supportive housing. And that's why it's green, because by the time we implement this, that service will be available to them. More than likely, individuals will be getting those services from one of our doorways providers. That's what we're envisioning right now. And then their supportive housing package would be these 3 services: the assessment / annual plan of care development, the supportive housing per diem, and then the one-time transition costs.
And I'll add one thing. I think we had talked about one other track, because the SUD and the developmental services packages look the same. The other one would be all 4 components. So for the housing providers on this call who don't do choices for independence, aren't developmental services, aren't a CMHC, although some of you might be, and aren't an SUD provider, we would be able to turn on all 4. And one of the things I'll send out with the slides and everything is the actual description of the services, because I think the name doesn't tell you everything. What we had approved really should cover a lot of what you do day to day based on eligibility. So I will share that information so that you can see it. And we did have a question in the chat. It says, what if the service that they are receiving through another system is not at the level of intensity necessary to be effective? For example, case management is only happening within offices, and what they really need is community-based. Could the supportive services benefit provide the more intense level needed? And then Angie, we'll get to your question after. So Diana, do you have?
So at first blush, I would say no, they're not eligible to be able to get the two different types of case management. What would really be more appropriate is for the case management approach at whoever's the primary case management for that to transition to actually be able to meet their needs. That is within the scope of case management services. But individuals will have freedom of choice. So if there is an individual who is not happy with their case management service, they would have that option to try to get it elsewhere.
Erin, does that help answer your question? And you can just respond in the chat. And then I'll read through Angie's question as well. So Angie is at a CMHC, and she asks, with these benefits, do all clients that are receiving a housing voucher due to meeting the criteria of homelessness must participate in order to be housed? Sorry, another chat came up and it moved it. In order to be housed and supported in order to have these services. Angie, do you mind coming off mute and explaining what you're asking?
Sure. So I'm just asking this basically because I know with the grants that I have that the clients don't have to participate in services in order to be housed. So in order to be housed with these particular benefits, would they have to participate in services in order to be housed? Does that change anything with the grant? No. Okay. Thank you.
It's really what this is a funding stream to support the services. Clients always have the option to choose.
Right.
Right. And it doesn't, this stands on its own. So it's not connected to a housing service, an actual, you've obtained housing through this. So it doesn't pay for the actual housing. And so that's why it's sort of separate.
That makes sense.
Okay. All right. That's it for questions for right now, Diana.
All right. And Melissa, I did add that fifth track at the bottom. This hadn't been updated yet, and I missed that in the update. So I just added it at the bottom.
We did get one more question that says, can clients choose two different providers to cover separate benefits they are entitled to? So I think, Sandy, it sounds like what you're asking is, could one provider do the targeted case management while a different provider maybe does the community transition piece?
Yes. Yeah. So I think that's what we envision to happen a lot. For instance, the CMHCs, for workforce shortages, et cetera, they're pretty strapped for staffing resources already. And, they have the targeted case management. So they might be able to devote the resources to do these first two things. And they could certainly, as a provider type, when we set this all up, they could sign up to be able to provide these two services. But if a particular center said, we don't want to get into that, they don't have to sign up, and the individual could get these two with the center and these two with a different provider.
Okay, great.
We ready for the next slide, folks?
Yes. And Kayla, I will address your question as we continue moving on, okay?
All right, I will turn it over for you. Well, do you want to do this one, Melissa, or do you want me to?
I can do this one. I think this is relatively straightforward. So the way the benefit was written and approved is for individuals who are not connected to one of those existing services as shown on the third bullet. they would go through our coordinated entry system and be referred out through the regional access points to different permanent supportive housing providers, exactly the way all of our referrals come in right now. It would just give you the option to bill for this benefit. The existing partners, as we see referrals come in and we're checking new heights within my bureau, we would be referring them to their existing partners. So as far as like the flow of work, for those of you who are already engaged in our coordinated entry system and are already engaged with our regional access points, the flow actually shouldn't change much at all. It will open up billing options for you, but the actual referral process will still come through our coordinated entry system. And then we did have one more question. So Kayla is wondering if they had a housing program that only had operation expenses without supportive services funding, this would be a funding source to offer the supports that they may need. And yes, that's exactly what, that is one of our hopes with this. And then I have future hopes that I won't dive into today because it's too much for this level of presentation. But Kayla, that's exactly what we're hoping for. Okay, so I think we're ready for the next slide, Diana. And this one, so I think for purposes of this presentation, a lot of the items on this slide, as far as next steps, are really internal for the department to make sure the systems are turned on so that billing can happen, to make sure we've confirmed with CMS that everything we're trying to do is valid, legitimate, will still be approved. One of the things that is not on this slide, because it is so very new, is there's actually an intensive technical assistance option that's just come out. It's a HUD CMS partnership to provide assistance to states who have this benefit and one other benefit specific for housing individuals experiencing homelessness that we are most likely going to apply for. I'm gathering all of the information we need for that. And that would probably make that first bullet there, the obtain technical assistance part, stretch a little bit longer if we're selected, because they would be providing a year of intensive support to the states that apply or that are selected. As we roll into the new year and we've done the work on the back end to get our new height system up, set up so that we can do the billing and everything, then we'll start doing provider training for partners who are not Medicaid billing already. And folks who are Medicaid billers, we would support the process of applying. I don't know if it's applying or enrolling to bill for this particular benefit. So I anticipate a lot more information in the new year for people who are interested in billing Medicaid for these services. Anything else, Diana?
Well, I just wanted to share, I agree that much of this is internal, but one of the things that I wanted to make sure we carried forward in our messaging here today is when we do the eligibility through the new height system, in the billing system, we'll open up the codes, but basically what we're going to try to do is take whatever provider type the organization is and make sure that provider type has access to build these particular codes so that it crosswalks through the system. So these services will be available to the Medicaid beneficiaries that are eligible for them, but not every Medicaid provider is going to be able to provide those. We're going to make sure we tailor the approach so that we're working with partners and having these discussions and connecting people together. The other thing is that as part of the department's efforts, we'll work with our long-term services system, this system, the community mental health system, and the managed care organizations also, so that when we go out there and we do guidance documents, announcements, et cetera, we're going to be trying to have a a collaborative awareness, if you will, of the benefit being turned on, because we do envision so many individuals will get some services from one provider, other services from another provider. And then also by the time we turn this on, we should have our new closed loop referral solution in place, which will connect doorways, the 211s, the service links, hopefully most of the housing providers, and the Medicaid teams, et cetera, in a platform that will make it easier to refer individuals for the services, and then to see those referrals accepted, and to have like assessment tools available, et cetera. So that's some of the technology that will be available when we turn this on.
All right, so more to come on that part.
Okay, so I shared that these are the 4 services. The codes are here. They were all of this information on that little table was actually in our application. So there's just a note at the bottom that these are older rates from when we applied. We'll update the actual rates before implementation. But these are the codes, and your respective organizations. I don't know if you're going to want to do any research into them, but that's what they are. All right, now I have to zoom out a little bit. There we go.
All right. So Erin had asked a question in the chat about eligibility, and this should help with that question for now. The way the benefit is currently written, really, you're required, I'm pointing at my screen, like you can tell what I'm pointing at. So part 1 is the individual requires assistance with achieving or maintaining housing as a result of a disability or disabling condition as described below. It could be other disabling conditions, but it really needs to, these 1, 2, 3, 4, 5 categories are what were included in the application. So it doesn't matter. I think my point was, it doesn't matter what kind of disability a person has, as long as that disability is impacting one of these 5 categories. So it could be developmental, it could be a mental health diagnosis, it could be any number of things, but it must be impacting one of those 5 bullets. The second part of the eligibility is, Diana, are you able to scroll down just a, thank you, perfect. The individual must either be chronically homeless, and we know there's a really big definition for that, at risk of chronic homelessness, and we have, there's a little bit of flexibility there as far as what that actually means, and then has a history of chronic homelessness. So where this benefit's not looking to serve somebody who's maybe newly homeless and might have a chance to resolve with sort of a lighter touch. This is really looking at serving the individuals who are most vulnerable in our system. That doesn't mean that over time, when we revisit this, we won't reassess what our population is, but we really are looking at that chronically homeless or almost chronically homeless population. I can't remember what else I was going to say about that, but I think that's it for right now. Diana, any thoughts on what I've missed there?
No, the one thing I would share is that, when we look at the population that usually participates in choices for independent living or the ABD or DD waiver, those individuals do not typically have a history of housing instability. But we want to make sure that our approach isn't excluded them in case somebody does. So in case you guys are wondering, well, why do they have this other population? They're almost never homeless or have housing instability. That's why, because the possibility is still there.
So going back to Erin's question, I think it would be fair to say that most of the folks that we serve who are experiencing unsheltered homelessness would likely fit into this category. An emergency shelter as well. the transitional housing or transitional programs, I would need to do a little bit more research, because I do know that transitional housing changes a person's definition per HUD. So I just want to make sure I do a little bit more research before I can like commit to that answer. But I will look into that, and I can get you more information as we move forward. And then Sandy did ask, are homeless housing service providers only able to be reimbursed for services provided to individuals in rapid rehousing, permanent supportive housing, or other CoC funded programs, as opposed to the many others who are moving to or in other housing? So Sandy, no, it's not tied to any specific housing project. It's really the individual's eligibility status. So if there's an individual in an emergency shelter who is chronically homeless, trying to move out, that gets a voucher somewhere else, you could provide those services to that person if they meet this eligibility criteria. Okay. Okay. Think we're ready for the next one. Can you zoom? There we go. Perfect. This is a very high level overview of the services. I will send a much more detailed list when I send out the slides. But for transition services under the housing stabilization services category, it really is all of those things that you're doing to help individuals plan for, find, and obtain their own housing. So it could be the housing search and application process. It could be help with landlord negotiations. It could be coaching somebody on how to sort of advocate for themselves with a landlord. Anything that might help them secure that housing really could fit under this category. And I do have a more detailed list that I will send out that gives a few more concrete examples. But it's the work that many of you are doing every day that you could then bill Medicaid for those services. We can move on to the next one. And these last few slides really are just high level overview of the services. So the sustaining services are the things you would do to help somebody maintain their housing. So Sandy, in your example of somebody maybe getting a different voucher that came out of your shelter, this benefit could help provide the services to help them maintain that housing if they were eligible at the beginning, if that makes sense. And it's very similar things. It could be, again, landlord mediation. It could be helping them understand their budget and setting up a process for paying their bills. It could be any of those services that might be needed to help somebody transition back into being housed. For anyone who's at the Outreach Summit yesterday, our keynote speaker talked about how when he first went into housing, he slept on the floor the first night because he didn't know how to be inside. So things like that to help somebody maintain their housing once it's been obtained. And then our final slide. This is the housing consultation services. This is our once a year annual plan. For those of you who provide continuum of care services or continuum of care housing projects, you're already used to doing that annual plan. This would be, my hope would be that we could time it and kind of align it so that it happens at the same time each year. So you could do your CoC annual plan at the same time you're doing your Medicaid annual plan. For individuals who are not in a CoC project, you would have to do a once a year person-centered plan with them to sort of reassess their current status, see if they still want this benefit, because they don't have to keep it if they don't want it. And then see if there are different services that are needed to help them maintain that housing. And that is our last slide for right now. So this is really sort of this is what's coming kind of presentation. We don't have every single thing worked out yet, but we're committed to working with our technical assistance teams and working internally with our Medicaid team to make sure that we can make it happen. Are there any other questions right now before, I know Diana has to take off for a meeting in a minute. So any other questions before Diana has to go?
Melissa, it's Will. I have
Hey,
a
Will.
question.
Sure.
From a reporting accountability perspective, have you thought about how impacts staffing levels? I mean, is there any thought to, geez, this is going to be a lot more work, paperwork or computer work, tracking, and so on and so forth? Do you see just doing this with existing staff, or is there going to be a need to add additional administrative staff to manage this process? It's probably a strange question.
No, it's not a strange question, but I don't think the answer is straightforward. So I think it's one of those answers where I have to say it depends. So I think for partners that already bill Medicaid, it will be a much easier lift. The work that's already being done with existing staff will continue to be done. And the administrative side of billing, they already have the infrastructure for. If it's an agency that does not bill Medicaid, I do think there would be a bigger lift, and maybe it would be something that you wouldn't jump into right away. You learn and you partner and you wait and see. So I don't think I have a great answer yet. Diana, I don't know if you have anything else to share about that question.
No, I'm thinking the same thing, is that for one thing we didn't share is, our estimate for the number of people this would serve in the first year is around 50 or 60 people. So we don't necessarily think it's going to be a huge volume at first, because there are eligibility criteria regarding it. The other thing is that we're hoping to turn this on around July. I don't know if you mentioned that when you opened, but I think we're targeting July, and that gives time for organizations to explore and think about who they might want to partner with. So, for instance, we typically allow Medicaid enrolled providers who want to use other staffing resources, like to subcontract some of the work, just assuming all the provider qualifications are met, et cetera. So you may have one organization that partners with another organization that is a Medicaid enrolled provider, and they enter into some contractual relationships, things like that. But I don't think there's a specific answer. If anything, we think these resources will help resource more staffing.
Thank you.
All right, I saw Freeman's hand first, then Angie's. And Meg, I'll answer your question in the chat just in the interest of time, because I also have to leave in about 7 minutes.
So just real quick, with the staffing concern, we do have parts of our agency that are billing to Medicaid because we have ServiceLink here internally at CAP, and I won't speak for their process, but what I will say is when I was looking at the chart that talked about the billable rates, one of them was like $49, and obviously I know you guys said you're in the process of updating those numbers to whatever the current up to the minute number is, but when I look at a rate like $49 or $59 for a daily billable case management thing, I know we're not paying any of our staff $50, so that billable rate I think pays for some of the ops staff where the role is divisible, right? So the paperwork and the Medicaid actual billing piece of it is one piece, and then the person performing the action with the participant is the other piece. And I think that if I'm reading that chart correctly, that you can kind of divide that billable rate up into what you need it to. And while it's not going to be a perfect situation, it does seem like it pays for the added work, and maybe you've got some case managers you didn't have before because of this service. Am I correct there? Is that something that would be feasible, Melissa?
So this is an area where I worry I'm going to get myself into trouble because I don't know Medicaid well enough. But I do think part of what we've been exploring is, revisiting our budgets, because if we're able to bill Medicaid for many of the things that are being paid for with other funds, the idea might be that those other funds could support some of those other needs that we're talking about. So I don't know exactly, Freeman, because I am just, that is like that's where I start to get stressed out about the Medicaid part.
Yeah.
So Diana, do you have a good answer for that, or is it something I can research and bring back to you?
I just think that what he described is very possible. That's part of what we see are the benefits here, is that it would the rate is enough to sustain positions to do some of this work, right?
Yeah.
So like for instance, in for individuals who have targeted case management from a community mental health center, that is a monthly rate for them. It's not a daily. But individuals who have it under CFI, it's a daily rate. If it's transitional services. So there's different forms of targeted case management, but I think having a daily benefit associated with this does make it a promising service to deliver. This targeted case manager role, I don't think the qualifications are as stringent as some other benefit packages.
Angie, you had your hand up as well.
Yeah, so that I think Diana just answered it with the daily benefit, because I do have some high rollers that, you know, I do speak to frequently or assist daily with their housing needs, depending on what the situation is at the moment for them. So I was just wondering about a daily benefit. I did not notice that before. Thank you.
Yeah, you're welcome.
Erin, I was starting to answer your question in the chat, but I don't have any other questions right here. So Erin asked if we're working with the New Hampshire Rapid Response System to be prepared to do the disability assessment and paperwork necessary for that, noting many unhoused individuals are not connected to other services for these assessments. That's not something we've done yet, but it's not out of the question for the future. I think based on the targeted numbers we were looking at, we already have more than, I don't want to say that the people who aren't eligible yet aren't worth serving. That's not what I mean, but I feel like it's going to come out that way. I think this service can help us with the folks who are eligible already, and we can redirect some of our other funding to do some of those things that you're mentioning that haven't been done yet. And that intensive technical assistance that I'm hoping to apply for, actually, I'm pointing over here because this is where my chat is, requires that we partner with a lot of the folks that do that rapid response work. So it's one of those things that I think is coming as we build it, but as of right this second, it's not in place.
Melissa, that rapid response that you're talking about, that's specific to the housing system. That's not the mobile crisis one.
I am not sure, actually. Erin, can you clarify? We don't have a rapid.
I was talking about the mental health mobile crisis system throughout the state, because those are oftentimes the only mental health providers or assessment providers that unhoused individuals are interfacing with, who might be able to be the qualified clinician that could assess them and determine that they have one of the kind of decision-making or maintaining healthy relationships or challenging behavior disabilities.
Okay. So so I'm glad I asked that question. You know, we will be presenting this whole package to the community mental health centers. The community mental health centers staff all of the mobile crisis teams in the state, either directly or through subcontractual relationships, but I believe they're all still directly. And you're absolutely right. They could help do the assessment. They could help do a plan of care development if that's what they end up wanting to start doing. They will only be able to do that if the individual's acuity level matches the acuity level that opens them up to community mental health services as a benefit package. So for instance, serious mental illness, serious and persistent mental illness, et cetera. So that's a high acuity. There are a couple of community mental health centers that are looking to become certified community behavioral health clinics. And if that happens, which is supposed to be in 2024, if it does happen, they would serve all acuity levels. So they would be ideal, and supportive housing services is a requirement of those clinics to be able to provide.
All right, so we have 2 more questions, and then I think we could probably talk about this for the entire 2 hours, but unfortunately we aren't able to do that today. So we'll take the last 2 questions, and then if you have further questions, please send me an email, and I'm happy to follow up and get you your questions answered. Meg's question was first. She asks, if we are an SUD Medicaid provider, would we have to credential with Medicaid as a different type of provider?
I don't think you'd have to re-credential. I think it's just a matter of, we will identify. So you're like a 222 or a 223?
Meg says
yes. She says yes. Yeah. No, I think that's one of the those are the provider types that we want to open up these services to. Just like 093 are the community mental health centers, et cetera. So I don't think you're going to have to re-credential.
We can get more information on that though. And then Angie, did you have a question? I saw your hand go up.
Yeah, I just had a quick question. So with this benefit, I know there's obviously certain criteria that need to be met. Would this also apply towards your current clients that we currently house at our SMI, SPMI, and getting services through the CHMC currently, but also needs that extra support for supportive housing? For example, my 2 grants that I have about, I think I'm at 80 vouchers that are housed for supportive housing services. So would they all become eligible for that because they have to meet the criteria of SMI or SPMI in order to get vouchered?
I think it goes back to the homeless status and the homeless definition. So I think we'd have to look through that, Angie, and figure that out. Because I think once they've been housed for a long period of time, they would no longer be considered chronically homeless. But we could look at those other definitions and see, like, are they at risk of or recently chronically homeless? So we could look at that and maybe talk through it a little bit more. That would be a great question for when we present to the CMHCs as well, I think.
Yeah. But that's exactly the kind of scenario that we envision, is that as long as they can meet the eligibility criteria under the supportive housing package, then they should have access to the services. Now, earlier we had a question about what if they're already getting targeted case management, but it's in the office and they really need it in the community, et cetera. In the event we have individuals who need targeted case management from 2 different systems, say the CMHC at the monthly, and then they need like a supportive housing that's separately, the department does have the ability to do individual based waivers to enable dual case management. The challenge is that the scope of case management already includes development of a plan, et cetera. So it would be a very fine line we would have to walk. So these really highly complex cases, they will have to be, individually handled.
All right. On that note, as you think of other questions, please feel free to email me, and then our internal team can look through them and I can send responses back. And this is definitely not the last time you'll hear from us about this as we continue to roll it out. But in the interest of time, Diana and I both have to leave for an 11 o'clock. So I'm going to turn it over to Heidi for a presentation about our YHDP projects and our Youth Success Project. I'm going to appear as if I'm here, but I won't actually be here. So I won't be able to respond to any of your questions. But thank you all for coming. And I really look forward to rolling this out with all of you. And Diana, thank you for helping me with the presentation today.
Thank you. Thank you all for your interest in the program. Bye-bye.
Thank you, Melissa. So I'm going to share my screen. This will be fun because I'm going to say the same thing as Melissa. Hopefully it won't give me too much of a hard time. And I'm going to start with myself on the Bureau of Homeless Services. And we're kind of going to give you a rundown of what's been happening with the YHDP projects, sort of what they're about, where they're at, and hopefully all the projects are still here to be able to share. I have Brenda Gugesberg going first with Compass, and then I have Waypoint following that, then the Youth Success Project, then Tri-County CAP, and then the Claremont Learning Partnership. So in that order, and what I will do, and now comes the fun part, will watch me share my screen, see how this goes. This one. And then can everyone see? Maybe a thumb. Ooh. Okay. So what we have, let me see if I can move this out of the way. And then we'll do slideshow from the beginning. Okay. All right. Which one do you guys see?
The Continuum of Care project presentation slide.
Okay, but it's not in presenter mode?
It's in full screen.
Perfect. Okay. Next. So in terms of the Youth Homelessness Demonstration Program grant, the Bureau of Homeless Services received 2 grants for the Homeless Management Information Systems Group with the Institute for Community Alliances. They have that grant through YHDP, and it's also for coordinated entry for youth homelessness specifically. And through that, we are doing youth case conferencing with Christy, doing that through our coordinated entry system. Thank you, Christy, and helping me to do that. And then we have our projects themselves. And so the next slide is going to be the upper room. They have a youth navigator project, and Brenda Gugesberg, and I'm not sure if Mackenzie's here, but Mackenzie Kitteray is also working on that project as well. And then I will put the slide up for them, and you can tell me when to click, and I will pass it over to Brenda.
Okay, so hi everybody, I'm Brenda Gugesberg. I'm with the upper room, and we began our work with our Youth Compass program about a year ago, but really started taking hold of the work in the spring. I'm going to give credit to Angie Moran at CLM and our partners at Family Promise and Waypoint, Aaron, and the people who've kind of guided us along. We've also stumbled into this work. Eric and Kathy Pellerin and a bunch of us have really kind of learned to work together and figure out what we're doing. But I feel like we're in a really good cadence, and we're doing some really interesting partnerships and work on behalf of youth in our area. So you can click. Right now, the services that we are providing, we obviously connect with and work with a variety of organizations, including Waypoint a lot. And we are providing case management outreach. We do cooking classes here. Sometimes we're doing laundry. We're helping people get showers, just some basic concrete supports, making sure people have tents and clothing and jackets and shoes and padding for under their blankets and that kind of thing. Mackenzie's out several times a week. Sometimes she is with Derek from CLM, and sometimes she's out just meeting some of her folks, but really trying to make sure that she's connecting with the youth in our community and working with our schools and our liaisons locally. Our goal is to get people stable, get the youth stable, and she's done a really nice job getting a few people, with the help of some of our partners, getting people safely stable and housed. We have a couple of people who have found housing, stable housing. One student went to college, so he has stable housing, and a couple of other people have found housing. We have an individual who is just finished our HiSET program, which is the GED program, and he has completed that and has got a full-time job, and so he is almost complete with some of his goals here as well. I think you could probably click here. We actually have served 14 youth, not 10. And Mackenzie's doing things, you know, sometimes we're meeting a client in an unfortunate situation at a police station or a hospital because something has occurred. So she's really just trying to connect where they are at. Why our program seems to be working well is we have a lot of match services here in our organization. We have a food pantry, which is definitely helpful. We have a HiSET program. We have a cooking kitchen, so she's oftentimes in cooking with people so they can take stuff to go. We do have a counselor on site, which our clients have access to, and a couple of them are using our mental health counselor. We have an anger management class, substance misuse education and support. We offer community service. We have family support. So if a young person has a family member or family that will support or could be supportive to them, we're trying to connect the whole family together. We do have a teen parenting program. So we have a couple of our clients who are using that. And we have a family wellness program, which includes comprehensive family support. We're going into the homes and trying to stabilize and support families when they're in need. Some of our strong partnerships are Center for Life Management and Parkland Behavioral Health. We are working with Job Corps for placement, My Turn, YMCA, CART, MTS, Waypoint, Western Rockingham CoC, and the town welfare offices. I'm going to be excited when Family Promise gets to Derry because I think that they will also be an asset to our work here. Okay, you can click. So I think, you know, what we're seeing success in how we're trying to help move people through. And let me just say that we all know that this is the good stuff. There's also the really hard cases too. But what we're seeing in our successful cases is that people are coming in with a lot of barriers to access of services. And we are trying to create plans for them to move them to higher levels of independence and security. So one individual, this is a framework of one individual needed his SSI stuff. So we connected with him with SSI. He began his HISEP program and finished that. He has a job. He applied and then got a job. He is using and visiting mental health support. And he is now working towards stable housing. And we are like a step away from him being complete with his program. He has used multiple assets that were available to him. And our case, Mackenzie, has really reduced barriers by providing Uber and being willing to meet him in places out in the community so that access to her and her support was available to him at times of his need. So that's just one of our kids. You can click, Heidi. And then, oh my goodness, is that the end of our end? Okay, so it's been really quite a journey. Heidi has been a cheerleader and champion for all of us at times when we're wondering what we're exactly doing. But I feel really confident that with the people on this call that are in partnership with us and just really the way people are handling this statewide, I think our youth and our homeless populations are going to have compassionate service and a connected, unified support system. So thanks, Heidi.
Thank you,
Any
Brenda.
questions? I don't know. Does anybody have questions?
You might want to come off mute because I cannot see the chat from here. Sorry, guys. Okay. If there are no questions, thank you, Brenda. I'm going to pass it over to our Waypoint team for you to go ahead and start your presentation.
Awesome. Thanks, everyone. I am Erin George Kelly. I am the Director of Homeless Youth and Young Adult Services here at Waypoint. And we're going to be talking about two of the YHDP projects that we have, our host home project and our rapid rehousing project. So we're going to start by digging into host homes. The host home project is a project that is geared towards meeting the needs of young adults 18 to their 25th birthday, who fall into the categories of homelessness 1, 2, and 4, which is literally homeless, at imminent risk of homelessness, or fleeing domestic violence. This program covers Merrimack County and Stratford County, so those are the two areas that we're digging into. With this program, we're doing recruiting of host homes. So a host home is anyone who has an extra bedroom in their home who is willing to allow a young adult who is in a place where they would choose a family setting as their transitional, safe, stable place to be staying. And the host home through the recruitment process, there is a home visit that happens, a background check that happens. So through those pieces and an application process, through those pieces, we're screening host homes to determine if they're the right fit, and then matching them with young people who also are the right fit. So they are young people who are choosing a family environment as a transitional plan that they are willing to live in, and that are safe enough to be able to live in a family's home. So we have currently matched 5 young people who are successfully living within families at this moment. We've worked with 11 young people in total. 1 young person was successfully transitioned out after they reunified with their own family members. And we're continuing to provide supportive services to the young people who haven't been matched yet, but also to the young adults who are matched and living in families, and the host homes, right? As those families are coming into doing this work and having a young person living in their home, it's important that those families know that there is available support and services for them as well. Kind of like what Brenda was saying, we do utilize a lot of the existing Waypoint services to provide the wraparound supports necessary. So our Waypoint Homeless Youth Department has the ability to provide an emergency 24-hour kind of after hours and on the weekends, holidays, emergency number. So if a young adult or a family needed support after hours or on the weekend, they have the ability to access that as well. While a young person is in a host family, we really are working on the 4 core outcomes of making sure that they are building permanent connections and improving relationships with safe, stable people in their lives, that we're helping them to improve safety, improving their well-being, and improving their self-sufficiency. So really thinking about employment and education in those ways. So helping them to be able to use this time in the host home to really focus on some of their goals, so that after the year when they're in the host home, they can start to really transition plan to a safe and stable place. And after they transition out of host homes, we haven't gotten that far in our program implementation yet, but when they transition out of host homes, we plan to be able to provide aftercare services and follow-up as well. And again, the young people who are receiving supportive services and haven't been matched yet are also connected to our drop-in center to make sure that they're getting their basic needs met. And all of our young people have the ability to access the pro-social activities and life skill supports that happen in our drop-in center. So they have other opportunities to continue to meet their goals and work on the things that are going to help move them towards independence and self-sufficiency. And host homes also receive a stipend through this program to help offset the cost of having a young person live with them. So that is part of the support that we give to hosts is a monthly stipend to help them be able to pay for things like food and electricity and just the cost of having an extra person living in their space. So that's kind of the host home program in a nutshell. We can move to the rapid rehousing program. So rapid rehousing is a little bit different. Many of you probably know about the HUD-funded rapid rehousing programs for adults. For young people, it follows a pretty similar model and has some little differences. So we get our referrals through the coordinated entry system. Our rapid rehousing program really prioritizes vulnerability, and the goal of our rapid rehousing program is to prevent fatality on the street. So we really are taking the young people who are most likely to die on the street and provide them with an apartment. we have 5 units of housing in our rapid rehousing program, and all of those units are full with young people, including a brand new baby who just came home and moved into one of the apartments. This really is a housing first and low barrier program. So the young people are provided the opportunity to work with the care coordinator to locate housing and do a housing search and make sure that they're leasing up in an apartment that they feel comfortable in a place that they feel like they want to be living. We do pay their rent in this program. We have the ability to pay their rent for up to 3 years. And that really is based on the need of the young person and the level of income that they have. So looking at when a young person becomes employed or has other kinds of cash assistance coming in, making sure that they're picking up more of the rent and we're paying less of the rent, so that they are moving to a place that they can take the lease over once this program ends. Again, we're providing wraparound supports to help maintain housing. So, you know, a lot of the young people that we provide services to have never lived independently. And so coming into an apartment, it really is, there's a lot of support and just services that are needed to help them maintain that housing. And one of our other goals is really to help them grow their community. So when we think about their eco maps, oftentimes when young people come to us, we might be the only resource or the only support that they're connected to, and that they don't feel connected to any other people or places in the community. And so while they're living in our rapid rehousing program, our goal is to really connect them to supports and services and people and places in the community that help them to be supported over time and to be self-sufficient even after this program is over. So the leases are in the young person's name. So when our rental assistance is over, because a young person has the ability to support the lease themselves, or because they have reached that 3-year mark, we are, you know, the apartment is theirs. So they're staying in that apartment and taking over that lease, paying that lease. And we continue to provide aftercare services to make sure that if something comes up or they need more further supports, that they're connected to those things. These young people as well have access to the drop-in center and the supportive services that take place there. So the independent living skills groups and the pro-social skills groups. We have currently at our drop-in center, we're doing a budgeting group quarterly where a bank is providing some budgeting classes for young people, and it's really geared towards young adults that are navigating poverty. So it has been kind of tailored to meet the needs of this population. So that is kind of rapid rehousing in a nutshell. Very willing to take questions if anybody has any.
I don't see any questions in the chat, Erin, and I don't see any hands raised. If you do have any questions, please put them in the chat and we can respond to them.
Thank you, Erin. Our next presentation is on our Youth Success Project. We have Becca and Molly, if you guys want to come on.
I'm good, Heidi. You could go to the next. So hi, everyone. My name is Becca. I am the director for the Youth Success Project. Molly Huel is also on the call. She is the assistant director. And we also have our youth leader, Maddie, on the call as well. So I'm just going to run through a few things. So this is kind of a summary of all the projects and work that we have going on right now, all from like the YHDP grant, and all kind of stemmed through that. So I'm just going to touch on a few things. So we're working we're working with the Department of Education with K through 12 McKinney-Vento liaisons in the school, and we have been putting on training. So we actually have our final diversity, equity, and inclusion training today with the McKinney-Ventos, and we are also putting on an adultism training for them as well to help them, you know, better support their students and empower their students. We are working on an art book right now, which should be wrapping it up early spring, and that will be available for sale. It is art that is all created by youth who have experienced unaccompanied homelessness under the age of 25. All of our artists were paid $100 if their art was chosen. And there'll be like a little blurb in there and really spotlight the artist. We are doing work in higher ed right now. So with the support of Heidi, we have been doing single point of contact work in higher ed. So working with colleges and universities across the state to make sure that there is a single point of contact on college campuses for homeless students or basic need insecure students. Maddie is spearheading our rural outreach grant. And so we are working with communities in the rural areas to figure out ways that we can kind of bridge the gap between services and make sure that youth are being connected to the correct services. So we're working on figuring out what those gaps look like. But yeah, so we have a bunch of stuff going on. That's just a little kind of update and summary. I don't know if Molly or Maddie has anything else to add, but yeah, that's the Youth Success Project right now. We have a lot going on.
I don't see any questions in the chat. Yeah. So thank you, Becca. I thought I saw Eric on there, but so our next group is Tri-County Community Action. But Eric, are you on the call? I don't know if you stayed on or got kicked off.
I'm here. I don't know for how long.
Okay.
Hello, everyone. I'm Eric Becker, Housing Stability Director for Tri-County CAP. We currently operate 2 YHTP projects, the Youth Navigator and the Youth Transitional Project. It's the Navigator especially has been a really wonderful project to kind of tease out and work on because every situation that arises with each youth that we work with is teaching us something new about the area that we operate in from through the eyes of unaccompanied youth or youth experiencing homelessness or housing instability. We do cover Grafton, Carroll, and CoC County, which is obviously very vast. And transportation and density of resources is certainly an issue, but certainly something we're really excited about. Debbie Sheehan, our Youth Navigator, is really going gangbusters with that, and I think she's doing a great job. Do you want to go to the next slide?
Yep, all set.
Okay, perfect. And then the second program, as I mentioned, the Youth Transitional Program, we're currently utilizing emergency shelter space for up to 3 households. We're currently housing 2. And that has also been really neat because it's created an opportunity to not only create and adjust policy, but also look at existing shelter policies and other departmental policies to bring about some positive change. That's been really, really, really great. Certainly out of the 2 projects, this one has the most growing pains, but we're working on it. Yeah, also excited to have it.
Thank you, Eric. Any questions for Eric? Okay. Our next group is the Claremont Learning Partnership with Kathy Pellerin, Jillian, and Shay, and they do a joint transitional housing and rapid rehousing project. Kathy, are you here?
I am.
There she is.
We only have one slide, so it'll be pretty easy for you, Heidi. We are brand new to this whole HUD world. So there have, like Eric mentioned, there have been some growing pains in both our transitional housing program and our rapid rehousing program. In our transitional housing program, we offer 2 units, 4 beds in a congregate setting. Within that congregate setting, there is case management and then aftercare if our youth choose to leave us before they go into, well, if they're not before, even if they go into, with this model, they can, backing up a little bit, with this model, they can go right from transitional housing to rapid rehousing, which is unique to the YHDP program. So case management is a huge part of both our transitional housing program and our rapid rehousing program. And Jill is hugely responsible for the majority of that case management, as is Shay, who I think is on this call too. As part of our transitional housing and our rapid rehousing, all of our residents do have access to our drop-in center, which offers a variety of life skills programming as part of that program. Our food shelf, which is on site. We also have a clothing closet on site. We offer childcare, which we always keep a couple of slots available for the youth in our youth homeless shelter. And that has been extended as well to our rapid rehousing program. We have 1 youth in our rapid rehousing program that has a lovely little lady. And she visits our childcare center every day for care while mom works. For both of these programs, we get the youth come off of the coordinated entry list. And let's see, what else haven't I told you guys? For our rapid rehousing, we currently have 2 clients that are housed. 3 if you count our beautiful young little person. We're currently working with our local landlords to establish more relationships so that we have more of a broader variety of housing to offer the youth that come to us from the coordinated entry list. Because we're brand new, this has been a process, developing these relationships and really just getting local landlords to understand, who we are, what we do, what we can offer. And it's a stretch because, as we all know, some of the youth that come off the coordinated entry list are coming off of it without, the greatest credit history, with, potential evictions on their, with their past rental history. So it's getting landlords to look past those things and understand that, these youth that we're asking them to help us house are coming with case management, that their case managers are working with them daily if need be, multiple times daily if need be, to make sure that these youth are successful this time around, where they might not have been successful in the past because they didn't have support. We are helping them to build villages within our community, to have access to recovery supports if they needed, to have reliable childcare so they can continue to work if that was a problem in the past, to have mental health support right here on site if that is something that they need. So it has definitely been a learning curve, as Heidi can attest to, and but we're working our way through it. And so far, I feel like we've been successful with the youth that we have worked with. But time will tell as we go down this path how things continue to evolve from here. That's all I got, Heidi.
Thanks, Kathy. Any questions for anybody, I guess, in our YHDP programs? They've done, now this is me and sharing. There we go. There's been a ton of work getting things set up, people going through trainings, learning what a continuum of care does, what coordinated entry is, thinking about the assessment partners that you all kind of have down pat in different ways. So it's been a pretty big learning curve for some of these folks. And adjusting to the things that the Youth Homelessness Demonstration Program grant allows that a CoC might not allow has been pretty amazing, I guess I would say. The agencies that have been involved in this have been really on for the ride, and it's been a ride. So I just appreciate them all so very much. So if anyone has questions, please, you are more than welcome to raise them. Otherwise, if you have questions in the future, you are more than welcome to also send me an email and I can get them to the right project if you have a specific question about them. I think that might be it. The next thing on our agenda is the point in time count. And I don't have a name next to that, so I'm going to pass it to the person, hopefully who's here, that can do that part of the presentation.
So Mandy and Rob, I invite you to the floor. I see that Mandy is ready to speak about the point in time count that is happening in January of 2024.
It sure is. So it is coming to be that time of year again. So 2024 point in time count, the official day will be January 24th. So what that means is, well, just as a refresher before I get into that, I guess, is what is the point in time count? As a reminder for everybody, HUD requires a point in time count, which looks at everyone experiencing either unsheltered or sheltered homelessness on a single night in any given community. Surveys are conducted and carried out by staff and volunteers. Typically within the last 10 days, I think that's the requirement through HUD. So usually we do the last Wednesday of the month. So this year that is the 24th. Why do we do this? And I know there's always a range of questions of why in the middle of January. It is a HUD requirement that happens. We don't have to limit it to only being in January, but we have to at least do that one count in the last 10 days of January. It's important. It gives us the scope of homelessness across the country. You know, all CoCs across the country participate in this count. It includes both HMIS entering providers as well as the whole community that may not necessarily enter into that database. So it gives us a comprehensive snapshot, at least, of that one night. It helps us advocate for more funding. It gives Congress an idea of the need. And really, it gives us kind of the inventory of our own resources and the needs in our community for local CoC work. So as I said, 24th of January, that is the official point in time for New Hampshire this year. What that means is from 6 p.m. on the 24th until 6 a.m. on the 25th, we're going to be capturing where individuals stayed that night. So in New Hampshire, because we have very limited capacity, we don't have robust teams of outreach that can go out overnight as some areas like Los Angeles or New York City can do. For most of you, what that means is that you're going to be going out for outreach the next day. So Thursday, the 25th, asking people where did they stay the night prior. Again, that key time range, 6 p.m. to 6 a.m. Where were they? We're going to have a more robust and in-depth training the next Balance of State meeting in January with our friends at ICA, who I think are also on the call. Also, Rob and I will be coming out doing some road shows just to kind of connect with you all, especially for me on the unsheltered side, see how we can support your plans, really looking at how you're involving your community so that it really is a comprehensive and wide-reaching count. And I think we shared some fun point in time visuals that ICA has created, so in a range of different colors. We're encouraging you to customize those for your community and just really get out there and amplify the message that homelessness is out there. We need your community support. I think it's a great opportunity for you all as nonprofits to really remind folks of all the great work that you do as we come into the holiday season as well. So any questions, let us know. But again, if you did not get the HMIS newsletter that has some of the information, reach out to their help desk, which I can put in the chat. That will be coming out with further information as it develops.
And I just want to remind everyone that this information has been captured by HUD for years. And it does help us understand the scope of homelessness that we were seeing in New Hampshire. It also helps us with applying for funding. A lot of the PIT data is used when we apply for new projects every single year during the NOFO, the Notice of Funding Opportunity. So it is really important that we try to get an accurate count so that we can look at services and analyze gaps in our systems and apply for that crucial new funding.
Sorry, I have one more thing on that. At our outreach summit yesterday, one of the feedback questions in the survey was, do you want to be connected to a region for a point in time? So I do have a list of volunteers that are looking to be connected. So I'll be connecting with each of the leads for at least for the unsheltered side to make sure those in your region are folded into your community plans as you move forward.
Thank you, Mandy.
Before she's done, just a quick question. If there are folks on this call that are interested in learning who their leads are, do you want them to reach out to you, Mandy?
Sure.
Okay.
Mandy, if you have a list, we can also share it with the notes if you want.
Yes, so further information will be coming as it develops.
Thanks, Mandy. Looks like the next thing is the subcommittee updates, and youth is first. So I'll just give that one quick and I'll pass it back to you, Christy, for the coordinated entry. Yes. Okay. Youth subcommittee, we are having our final youth subcommittee meeting tomorrow, actually from 2 to 3:30, where a lot of the folks that have given their presentation today will be presenting there for our the folks that are a part of that subcommittee. And there will be plans for the coming year for 6 meetings instead of 4. They're going to be, I believe we landed on 6 work groups split over the year around continuing the work that we've done with single points of contact and working with the colleges and universities and to both gather what's there, looking at a gap analysis of what's not there around who has a single point of contact and doesn't across our college and university partners in New Hampshire. And then also looking at rural youth homelessness, the committee that Maddie has already started. Also looking at our youth count that's going to be happening next year. We did not do one this year. We did one the previous year. So we were looking at doing them every other year. So we'll have a committee for that again. And I'm sure I'm forgetting something. There's 5 or 6 of them. So, we are looking at a lot of what's been raised around our coordinated community plan. There's been some bubbling up about driver's licenses, driver's ed for young people who are having a difficult time both getting their IDs, but also getting driver's ed, being able to drive, that kind of thing. And the hurdles that they go through getting like literally practice time and being able to work on that. So there will be a committee, I'm not sure exactly when next year, but a subcommittee on that, or work group, I should say. And I'm thinking that's it. There's probably one I'm missing, but that's the biggest bulk of them. So we'll be planning for next year and continuing to work on that coordinated community plan. So thank you. Christy?
So the coordinated entry subcommittee actually just met last week. Myself, my co-chair Freeman Toth, and Connor Sperm also held a planning session a couple of weeks ago to kind of map out where we're going to have the subcommittee kind of work towards over the next year. Many of you know, and I'm very, very excited about this, that we were able to obtain and print marketing materials for all of the regional access points across the balance of state continuum of care, including our youth regional access points and the coordinated entry domestic violence point that we have. I am slowly distributing them to all of you, but most of the agencies have them in their hands, so you will start to see them. They are pamphlets, they're rack cards that can be distributed out within the community for people. We do have 3 work groups going right now. We have a training work group that is currently working on referral partner training and assessment partner training. We have a second group, which is evaluation, which is currently developing 3 different surveys that we are going to present out to community service providers and people experiencing homelessness. We also intend on having town halls to get feedback from people in the community with lived experience and who are experiencing homelessness, so that we can analyze their system and get their feedback about how the coordinated entry system is working. And lastly, we have our data analysis group that is currently working with ICA to look at the information that we have in our coordinated entry project So we can analyze where there are gaps, any disparities, and make sure that our system is equitable. Freeman, did I miss anything?
No, I think you nailed it, bud. No, the brochures are gorgeous. A lot of effort and pain and suffering was put into making those things come to fruition. Christy and I fighting with printers, and not really fighting. They were great. It was just a lot of back and forth. And yeah, I don't know, really stoked. Is it okay to mention the perspective timeline?
Yes,
Yeah,
of course.
so for surveys, so some hats are a changing. So I love training. I'm sick, it's fun for me. So once the surveys are like completed and it's time to like deliver them and run some town halls and really conduct that feedback from our community partners and our lived experience folks so we get real feedback. We're gonna start setting up those town halls and listening sessions and distributing the survey towards the end of February, early March, somewhere in that timeline is the idea. We want to get long past the pit count and all the, the HIC data and all that stuff that is, happens after our point in time count. We want to be free and clear of that so we can focus on this. Did I miss anything?
I don't think so.
Right.
It is the coordinating entry subcommittee is tasked with reporting to the balance of state every single year on statistics, the numbers served, information about referrals, where people are exiting to. So we are working on gathering all of that data to present to the balance of state, hopefully within, I'd say, the next 3 or 4 months, so that we can share all of that information about what's actually happening with the coordinating entry system. I will also share that as part of my job role, I've been doing a deep dive into the coordinating entry system, and I'm sure a lot of you have seen my emails requesting data cleanup. There will be more of those to come. There are a lot of participants in the coordinating entry system in HMIS. I will tell you there's now over 1,600 people entered into the coordinating entry project. So we're really looking at ensuring that the data that we have in the HMIS project is accurate and up to date so that we are making appropriate referrals, having case conferencing meetings about those most vulnerable and moving forward. Lastly, we are looking at starting case conferencing in Sullivan County within the next couple of months. Then we will be moving up to the North Country around to Stratford County and then finally down to Eastern Rockingham over the next year to get case conferencing fully implemented across the balance of state. I'm going to turn it over to Mandy for either a veteran or an outreach update or both.
Yes, I can do the veteran update. Unless any of the veteran providers are, I don't think so. Okay. So the veteran steering committee, veteran subcommittee, and the veteran case conferencing. So it's a comprehensive system that they're working on. Really excited to have Brenton Frazier, who took over for Amy Cook from the Department of Military Affairs and Veteran Services. So really looking at those 3 different components, how they interact together, and then how they interact with the CoC and larger community goals. So we have a steering committee coming up this Thursday, which includes recruitment of new providers based on the remaining challenges we have to end veteran homelessness. So things like there are still more veterans identified as experiencing homelessness than exiting into permanent housing within a 90-day look back. And the other benchmark we're not meeting is identification of veterans into permanent housing within a 90-day time frame. Of course, we know for both of those, the affordable housing crisis is the issue overall. One of the things we did in the last summit was to have a 50 and 5 challenge. So looking at, even though we're in this affordable housing crunch, is it possible to set a targeted goal, really rally around that goal and figure out some creative solutions to get vets in? So the goal was to get 50 veterans into permanent housing from the day of the summit, which was July 1st, we started it, to Veterans Day. And they actually just wrapped that up last week. So they hit their goal and went above it. They had 70 veterans they were able to house in that time frame. So it shows it's possible. It really got us thinking about how that happened, what the successes were, and then how to replicate that on a larger scale. So the steering committee members are expanding based on our challenges remaining. Things like priority veteran preferences, dedicated veteran vouchers, all of the things we've seen successes with both in our state as well as others. For additional goals, things like integration with Ask the Question campaign, looking at the veteran-friendly employer initiative and how we can replicate that to be a veteran-friendly landlord initiative. Again, just trying to be as creative as possible to put the priority, the urgency on getting veterans in and into housing and having them stay there with our services. I think that's it for the veteran stuff. Moving on to outreach. So we just had the outreach summit yesterday. Really just want to thank everyone that was involved in that. I was joking with Ashina afterwards. It always blows me away that outreach in particular, at least from my perspective, you're 1,000 places, you wear 1,000 hats, and yet you're always the first to say, you know, what can we do? How can we help? Do you need volunteers? What else can we do? So really do appreciate that. It was a collective effort, and I loved seeing everybody in that room yesterday. For those that weren't there, we were able to do some awards of excellence. The New Hampshire Coalition will be coming out with some of these photos that can be shared, but just recognizing the work, the incredible work that you all do every day. As Melissa started the meeting, really so important. A lot of different types of providers there, community health workers, nurses, primary care providers, clinical outreach staff, outreach providers, recovery staff, you know, peers. So to see the response grow and build and just have this, as Rob Waters, our shelter administrator, would say, bringing the family together and feeling that sense of community in that room yesterday, I think is just as important as the work you do every day. I know it's tough to pull providers out of the field, but I appreciate you putting the priority on that, getting some good training in, and just networking and being together to further that work. So I think that's all I got.
Thank you, Mandy. We have about 23 minutes left. So I don't know if any of the local continuums of care have any regional updates that they want to provide to the Balance of State Continuum of Care group and share anything that is happening locally for each one of your regions.
Hey, Chrissy, it's Angie. I'll go. Hi, everyone. Angie, Western Rockingham County. With winter approaching, we're seeing increased numbers in our region because we do not have any shelters of homelessness and those who are seeking support and resources. So we are referring out to other shelters the best that we can, but also supplying them with PATH outreach supplies. We have successfully done another October for the month of October. I've been doing it, I think it's my 3rd or 4th year now, and I set our goal for Center for Life Management for 1,100 pairs, and the staff here came through with flying golden wings, and we collected over 2,500 pairs of socks that I will be distributing out throughout various shelters and PATH outreach as well. As we all know, socks are one of the #1 items that are requested, as well as at the PATH outreach summit yesterday. With our guest speaker, he said, you try to walk around in 1 pair for 3 days and see how your feet feel. So socks are a very important piece to our homeless that we do work with, as foot health is extremely important on top of everything else as well. My staff is growing. I now currently have a PRA 811 team member who is overseeing that piece of it here at Center for Life Management. He's doing well. His name is Adam. He's learning the ropes and the ins and outs, and also giving him a little cross training of PATH outreach and our other housing programs that we have here at CLM.
Thank you, Angie, and I'm really glad that this October drive was successful. Anyone else have any updates from their region?
Christy, I can introduce everyone to our two new staff people who will be taking on the long-awaited Eastern Rockingham presence, along with 7 or 8 municipalities in Hillsborough. They will be doing coordinated entry. Ultimately, they will be doing the coalescing of community partners and all of that excellent work. Gary Blevin, who is on the call, and Juan Del Rio, who is on the call. They are 1 week today on the job and have already hopped into the HMIS training. They've been going through the binder that Christy dropped off what seems like 2 years ago. But truly, between the two of them, Juan has years and years and years of grassroots experience. Gary brings with him a wonderful technical background, which is really going to be helpful to us. He's a whiz with spreadsheets, so I'm very happy that he's already thinking about ways to make things make sense to all of us as we step further through this. I also, I forget who, it might have been Heidi who said something that toggled a piece of information. If anyone has kiddos who do not have an address, or anyone who does not have an address and they need to register a car, or they just need to have an address. I know that in Rockingham, you can come to any of our CAPs and we will provide a letter stating that that they can use that address. In years past, I know that the libraries also would allow packages to be dropped off if they knew in advance that someone was living in that area and they just didn't have a physical address. I don't know if that's so anymore, but definitely if there is a question of we need someone to have a physical address so they can register a car, any kind of thing like that, please get in touch with me and I can help iron that out.
I would like to say a very big welcome to both Gary and Juan. Eastern Rockingham has been doing coordinated entry for the last couple of years, completely unfunded. So we're very excited that they finally have some funding and have 2 full-time positions who will be working on the coordinated entry system and connecting people to housing. Anyone else?
Yeah, lastly, we have officially offered someone a position for a coordinated entry specialist for Belknap and Merrimack counties. So we will now have 2 coordinated entry specialist workers and are in the process of hiring and about to make an offer for one of our rural SNOFO outreach workers. And lastly, just because it was confusing to us, but I was very excited at the outcome of our SNOFO kickoff with the Bureau of Homeless Services team. We have defined at Belknap Merrimack CAP as our rural catchments are basically everywhere within Belknap Merrimack counties, kind of like Balance Estate works, but within Belknap Merrimack counties, it's everywhere that isn't Concord or Laconia. You know, that's our rural catchment. So people that are in those areas will hopefully, once we work out all the bugs in our own internal system, will get entered into those projects if they identify as experiencing homelessness in those communities. That's it. We're stoked. More people is good.
Any of our other local COCs have anything to share from their regional meetings? Because I know there's been some good work happening. With that, I will end the regional updates. Does anyone have anything else? We have an open floor for the next 16 minutes. If you have anything that you want to share, if you have any questions. I did put a plug in the chat that the coordinated entry subcommittee is actively recruiting new members. So if you're interested, please reach out to me directly. Sierra.
Yes, hi. So I just wanted to put in a plug for the peer group that we've put together for housing caseworkers across balance of state. So we've been doing that for a couple months now. It's just a small group of folks who, all of us work primarily with folks who are housed or trying to get into housing and either do, there's a lot of rapid rehousing folks, a lot of Waypoint people have jumped on. Got some folks here in Concord who have come on, but also permanent supportive housing. So if you work with clients in that capacity, like I said, we meet via Teams, and our next one is Thursday, December 7th at 1 o'clock. We meet for an hour, and it's just a really good chance for everybody to kind of brainstorm things. Sometimes it's just kind of, venting those specific frustrations, and to help with, sometimes that position where housing caseworker can be a little isolating. And so it's just a chance for everybody to get together. Christy, I don't know if it would be helpful to forward you the invite for the next one and then maybe just send that out to folks.
I would be happy to. This was something that Sierra had come to me with, was interested in starting the group. It's mainly for CoC projects, but I'm sure that other projects could be happy to join. I typically do not attend these meetings. It's for all of you for peer support. If you want me there, Sierra is welcome to invite me if you have questions or anything along those lines. I'm going to do a few plugs, and then I know Rob has one too. We do have a rental calculation training this Friday for CoC and YHDP projects if you're interested. And also there is a substance use disorder training that is happening on November 30th. I know there was some confusion about this training. I had sent out a registration. So if you're interested in that training, you need to register for that training. And we will be sending the invites out to everyone who is registered on Monday, the 27th. Because I know I sent out the registration and then canceled the meeting at the same time. So if you're interested, make sure you register. If you did not get the registration, please reach out to me directly and I will send you that registration link. And I know Rob also has a training coming up, so I'll let him bring that up as well.
I was going to say, Christy, I thought you read my mind, and then I was wondering what you thought I was going to share. I do have a training coming up on Thursday. It's from 10 to 12. It's going to be on Teams. It's a motivational interviewing training that I have affectionately called Motivating Clients for Success. I ran it a number of years ago at the CAP conference when I was part of SCS Nation, and I've adapted it over time to make it pretty relevant for today's work, taking some things out, put some things in, and kind of pick some things up that, was pretty pertinent that people wanted to see. Also too, I just want to put a plug in for a task force that we've been running for a few months now called Discharge Health and Safety Task Force. We typically meet near the end of the month via Teams once a month, and it's comprised of currently shelter directors and staff, outreach staff, and we have some hospital case managers involved, and we want to get welfare and mental health counselors and case managers involved and stuff like that too. The goal of this task force is for everyone to understand where everybody else is coming from, identify gaps in referral processes, gaps in understanding about what's expected of certain entities, and then trying to take all that information, put it together, and try to find a way that when we have folks that might be in like a rehabilitation setting or in incarceration or something like that, hospital stay, that maybe we can identify some better ways of and more efficient ways of when someone's approaching the end of their time there, finding a way if they're experiencing homelessness to get them the services they need, whether it be shelter or something like that. And that way people aren't left kind of on the street because of the of being discharged and really not having anywhere to go. So I'm going to throw my email in the chat if you don't already have it. But if you do and you want to be part of the group, let me know. I'll add you up. And the invite, I feel like we're going to be doing it probably, I think it's Tuesday or Wednesday after Thanksgiving is going to be our next meeting. So that's all I have.
I just have one plug. The training that Rob is talking about is separate from the motivational interviewing training that we've put together for the YHTP projects, just so that you all have a heads up, because I know you've already signed up. So I just wanted to clarify that. Thanks.
And separate from those MI trainings, we also have a very specific street outreach motivational interviewing. Well, I shouldn't say street outreach, brief for one time it's called. So including emergency situations such as overdose reversal, increasing the possibility of further engagement in services. We partnered with C4 Innovations, who was our keynote speaker at yesterday's Outreach Summit, to do 2 different live webinars that will be taking place in the month of December. So motivational interviewing is one, and the other is Equity in Action, Sustainable Change. They also pre-recorded a Taking Care of Our Outreach Providers that covers a whole range of impacts on the work, grief, compassion fatigue, vicarious trauma, moral injury, and how we can kind of navigate through using a trauma-informed lens. I will send out those links that have QR codes to everyone. They are free. Yeah, be on the lookout for that.
Now, also, I do want to add my motivational interviewing training on Thursday does not have any ECUs attached to it. So if there was something that you were trying to get for that, I'm not the guy to talk to. I would look into some of the other ones. Mine is more because shelter staff especially was really thinking about, after our last shelter director meeting, they'd really love to have a training on it. I offered them for the low price of free. I could put one on, or I could try to find somebody somewhere that could do it. They said, no, Rob, just go ahead and do one. So no ECUs for mine, but there might be with some of the other ones.
Well, if no one else has anything, thank you all so much for joining our meeting today. We will send out the notes and more information, and we will post the recording on our website as soon as possible. Our next meeting is the second Tuesday of January. I don't know the date off the top of my head. But I look forward to seeing all of you then. Have a great holiday season. I want to thank all of the veterans who have served, as we just had that holiday and memorials. And I look forward to seeing all of you next time, and at all the trainings that we have going on over the next couple of weeks. Thank you.
Once that asked me to just like close everybody out, so do I have to get everybody out of here first and then close it? Do you know?
No, that's why I was like kind of waiting.
Yeah.
Only a couple more.
Yeah. Okay. Oh, I can remove people.
There you go. I can leave. That'd be helpful.
Okay. Okay, I think that works.
Bye.
Maddie, you all set?
Yeah, sorry, I walked away because I was on the phone, so I missed the ending of this.
Oh, no worries. I think we were done. People were just kind of giving updates about trainings coming up. I was talking about the motivational interviewing, but you're already signed up for it, so you should be good.
Perfect. Bye, y'all.
Bye. Have a good rest of your day.